like to call on our first sharer. He is Dr. Bienvinedo Tamano. He is a diplomate and fellow in family medicine, a diplomate in International Board of Lifestyle Medicine, a diabetologist, clinical consultant, Tagaytay Medical Center, Hospital ng Tagaytay, and Silang Specialist Medical Center. He is a Railway Diamond 1-star. Duke Bien will be sharing his patient's case, who is a 94-year-old man who had been in ICU every month. But after taking PURTIER, those stops to ICU stopped. So ladies and gentlemen, let us welcome our first sharer this afternoon, Dr. Bienvinedo Tamano.
Okay, good afternoon. It's another privilege this afternoon to be able to join this Zoom telemeeting about three-way PURTIER placenta. And before I start, I would like to thank Dr. Olarte for this invitation and Lindy as well for this invitation. And may I have the privilege of also greeting some doctors who I have invited to join and view this telemeeting on PURTIER this afternoon. So again, I'm Dr. Bienvinedo Tamano. I'm now 65 years old, and I'm a medical practitioner from Tagaytay Medical Center. Basically, I am a primary care physician, being a family medicine specialist. I'm also a lifestyle medicine practitioner and a diabetologist. So I deal with a lot of diabetic patients on my daily medical practice. Diabetic patients comprise about 80 to 85% of my patients. And also I'm into the academia because I am privileged to be a teacher also in the Adventist University of the Philippines College of Medicine, just like Dr. Olarte, who is a co-faculty. Before I proceed, may I ask the permission of the viewers to allow me to, from time to time, take a look into my cue card so I don't miss my sequence. Thank you. I did not have enough knowledge about stem cell to start with, not until sometime in December 2018, when I had a conversation with Dr. Olarte during one of our academic fellowship program in AUP, where he discussed to me the benefits of PURTIER placenta and was telling me about his personal experience about taking the product himself. So I started to be curious and to start some research about PURTIER placenta. Personally, I thought, how should I be able to experience the same experience of Dr. Olarte if I don't try the product myself? So I thought of signing up and started a 7-bottle package, which I took personally. Initially, I took 2 capsules in the morning, then 2 capsules in the evening, which is the usual way we allow our patients to take this PURTIER on the intensive phase. Actually, if you're going to ask me how is my medical history, I am hypertensive, but my blood pressure is very well controlled with a very low dose of beta blocker. I'm also an impaired glucose tolerant patient, and I used to take metformin on a once-daily basis. I used to be very dyslipidemic before, with elevated triglycerides, elevated LDL, elevated VLDL, and a moderately elevated SGPT. In other words, just like the qualities, the characteristics of a metabolic syndrome were in me. So I started taking PURTIER placenta. It was not, the effect to me was not overnight. It was like about 3 to 4 weeks after taking the capsules that I started to experience changes. Changes that were apparent even if they were not overnight. Based on my personal experience, admittedly, there are some, for sure, there are effects that we cannot quantify. But so far as the things that I started to experience, I started to be more focused and more alert in what I do each day, in my tasks. I started to get some compliments from family members, even from my patients, saying that, "Doctor, what happened to your skin? It looks like your skin is continuously brightening and getting smoother." Things like that. My endurance for exercise became significantly improved. I became able to sleep well each night. And more importantly, after about 2 to 3 months of taking PURTIER, my lipid panel became normal. My blood sugar became very well controlled. My BP became very well controlled as well. And my SGPT went back to normal. I was amazed with the results of PURTIER. I may not have very big medical problems myself, but these things mean a lot to me. Having a well-controlled blood sugar, having a good BP, having a good lipid panel. So I thought this product must really be very good because I have this personal experience of getting these benefits and good results. So since then, I started recommending gradually PURTIER placenta to my patients in whom I see complications of diabetes. There are quite a number of them now who are on PURTIER, and most of them have varied conditions, like, for example, some of them in whom I have prescribed PURTIER placenta are having chronic osteoarthritis, poorly controlled blood sugar, poorly controlled blood pressure, diabetic neuropathy, which is very common as a complication in diabetic patients. Some of them have beginning dementia, and I thought PURTIER placenta may be able to help them delay at least the progression of dementia. All these patients have so far demonstrated improvement. But one of the most striking experience that I would like to share with you this afternoon, I have already shared it in one of the telemeetings under Ma'am Lindy, so I would like to repeat it this afternoon. It's about a patient of mine who is like the mother of Dr. Lecciones. This patient of mine is 94 years old. He's a male patient who up to now is enjoying a very good quality of life. Why? These are the pictures of this patient. The one in where he's in blue is a picture just about a month after he has been taking PURTIER placenta. And this is a very late picture of my patient, the one where he's in red. If you will take note of, firstly, the color of the hair of my patient has changed significantly from being very, very white to slightly blackish and brownish now, for which my patient is so happy. He keeps on telling me, "What's happening to my hair, doctor? Is it because of the effect of 4th-year placenta, even my skin at 94 years old, has begun to change in its texture. This patient has been recurrently anemic in the past, but now each time we request for update CBCs in this patient, we would find his hemoglobin levels to be normal throughout. You might ask questions that may be in your mind now. What could the lifestyle of this patient do? At his 94 years of age, is he still experiencing a good quality of life? Is it because of his medications? What is his secret? We know that the average lifespan of a Filipino now, according to the WHO, is only 72 years. But this patient has gone up the scale and still enjoying his life at 94 years old. Is it because of PURTIER stem cell? If I may be asked that question, I would straightly answer it with a resounding partly yes. Because since the time this patient took placenta regularly, he's now on his 5th 7-bottle cycle, and this is still enjoying the effects of PURTIER placenta. Because PURTIER placenta stem cell really did something unbelievable to this patient. This patient used not to be a patient of mine. He was only a referred patient. When he was referred to me as the diabetologist of this patient, when he was in ICU and he was ready to be discharged, we offered a prayer to this patient, and right away this patient requested that I become his attending physician from then on. And then I started, this patient is a strong candidate for PURTIER placenta. It did not take any second for him to decide, okay, prescribe to me whatever you want to prescribe to me, doctor, and I will be willing to take it. And the rest is history for this patient. This patient has been under my medical care now for almost 1 year and 7 months. His diagnoses are, he has HCPD, it has hypertensive cardiovascular disease, coronary artery disease, ischemic heart disease. This patient is status post-CABG, a 4-vessel CABG, which he underwent in the US. He has diabetes type 2, he has chronic kidney disease, and he has beginning dementia. He has all of the diagnoses you can think of for somebody who is 94 years old. But you will be amazed that in the past 17 or 18 months, this patient has not visited the emergency room and has not been confined for critical care anymore since the time he started taking PURTIER placenta. Before he started taking PURTIER placenta, he used to be rushed to the ER and gets to be confined for critical care almost every month. And his family has in fact talked to me that they were already decided that Lolo is going to have his few days on earth already, if this will be the case for him, being confined and put in the ICU for critical care every month. But the family and even the caregiver who even got an increase in salary because of what happened to Lolo, because of what happened to this patient, are now rejoicing because of the wonders and benefits, and because of the amazing benefits that this patient has experienced from PURTIER placenta. As a doctor, I am convinced that PURTIER placenta boosted my patient's immunity. And this is the very reason why there is the absence of recurring need for ER consult and the absence for hospitalization for pneumonia in the last 17 to 18 months. My patient has even improved his physical endurance. He used to be bedridden on the first floor of his house, but now he can manage to go up and down his house here in Tagaytay City. I believe that PURTIER has a very effective regenerative capacity, improving the skin of this patient. The excessive skin dryness of this patient has gone. The texture has improved. My patient is now young looking, even at 94, and even the color of his hair, and you can attest to that, has really changed. My patient has even improved his mental capabilities. Before, when he used to be my patient in the beginning, we would converse and I would be a little bit frustrated, you know, as a physician, particularly in assessing my patient, because when he talks to you, his frame of thought would be astray and would be out of the direction most times. But I am amazed that whenever we see each other now, like 1 year and almost 7 months, in continuous intake of PURTIER placenta, my patient can now converse very well. His cognition is very well, and he is purely and really, truly contented with PURTIER. His metabolic profile has significantly improved now, with improved HbA1c level. His prandial sugars and postprandials are on target. He has no anemia anymore, and even his lipid panels has really improved. There are many words from my patient, but to sum it up, I always tell my patient, doctors are mere instruments that God has provided to take care of the sick and to take care of the suffering. Because this patient would tell me, doctor, I owe you a lot, because if my case would have been the same, and if PURTIER placenta would not have been started on me, I would be gone by now. So I owe my second life to you, next God. And for this, I owe so much thanks to you. I will always tell him, I really wish that more and more patients like you, Lolo, would really benefit from the good effects and the benefits of PURTIER stem cell. If they can only see this patient of mine who is a living testimony to the effects and the wonders of PURTIER placenta, how can it improve the quality of life of even the very elderly? We will all be amazed. As a diabetologist, I would like to end this short testimony about my practice and about the experience of my patient by confirming that as a practitioner, PURTIER placenta would assure us better sugar control. It gives our patients better sugar control, both fasting, both prandial, resulting to target HbA1c. This is because of its regenerative capability or regenerative benefits. It helps normalize lipid panels. It helps control diabetic neuropathy, which is one of the very common complications in diabetes. This patient of mine and a few of my other patients who used to come and complain of leg pains, needles and pin sensation, numbness of their lower extremities, inability to feel from their soles and from their lower extremities, gets so much improvement after maintenance with PURTIER placenta. So I cannot overemphasize the good effects of this product, and I hope that I will be able to share and prescribe this supplement to many of my patients in the future, and through this very short testimony and this very short presentation, I shall be able to influence a lot of you, maybe some of my co-practitioners in the field of medicine to try prescribing PURTIER placenta to their patients as well. Good afternoon, everyone.